So what is psychological first aid? You know first aid is there. First aid means providing aid to physical injuries, initial aid to physical injuries. Similarly, psychological first aid means when your near and dear one, your friend, gets some kind of psychological trauma, and that point of time, even if you are not knowing the near and dear one, somebody else in your society or in your community, if he is suffering from psychological trauma and you are there, you should be able to relieve that trauma initially. Your role is limited. It is limited to maybe few initial days, maybe few initial you can say weeks, or maybe few initial hours. But that point of time you should be knowing what should I do. So this is psychological first aid, which you are going to learn now. Look this situation. Many people were killed and their skulls are collected at place. They were killed in communal rites. Africa. Entire village was killed and very less survivors were there. After you can say blast of volcano, ashes were all over. Entire village was burned alive and only few could survive. You know this famous Jallianwala Bagh partition, India-Pakistan partition stories. Then this Kashmir exodus, Uri attack. Lot of things is happening all over. Gaza, our country suffered Mumbai terror attack. So whatever is happening all over, do you think it is good for their psychological health? No. Certainly the survivors will have some kind of trauma to their mind. So in that situation, when there is trauma to the mind, we provide psychological first aid. So this is combination of psychology and first aid. Okay. So what is PFA? What is psychological first aid? It is human supportive response to a fellow human. Suppose you are not knowing the person, he is unknown, but still he is a human, and you are there. Then whatever psychological support you are providing, it should be in the form of psychological first aid. What is the approach? The psychological first aid is developed to ensure that person who is suffering from any kind of unnatural calamity like tsunami, disasters, or man-made actions like war situations, terrorist attack, some kind of chemical or radiological warfare attack. In that condition, survivors should be given a kind of emotional comfort and a guidance to get recovery. So what should we do? We have to prepare ourselves first, then only we can provide psychological first aid. So what is preparation? Preparation means you have to learn about what happened, then you have to learn about when happened, then you have to learn about who all are affected. Suppose there is a flood situation and you are being deployed there, so you have to learn now where it happened, when happened, how many people are affected. So that is learning about the crisis event. Then what are the services available? If I am going there, what is the possibility of getting shelter appointment for the person who are suffering from those crisis event? What are the food facilities available? Where to get the security? Where to get the communication facility? How the person should be evacuated to nearby medical settings, hospitals? Who all are aiding agencies there? Is there any civil authority aiding agency there? So we have to find about the available services available at that point of time or being integrated to that location. And then we have to also learn about the safety and security of the place, whether that volcano is still active, whether still there is chances of having earth tremors, whether the combat situation is still going. If safe, then only we can provide psychological first aid. We cannot provide psychological first aid going into inside the Ukraine war area at present. Actively, it is highly active. So these things we have to see whether we are safe to provide psychological first aid or not. So these things come under preparation. That means getting information about the event, the available services, and our own safety and security. These are the things also. This gives idea about our limitation also. Then we call it look, listen, and link. This is the important three terms: look, listen, and link. So we have to look for safety. Whenever there is a person who is in danger, bring the person to safety. That is the first thing. Then we have to look for urgent basic need. Suppose a person is there. What is the basic need? If a person is shivering from cold, clothing is needed. If the person is suffering from hunger, thirst, then food and safe potable drinking water is needed. Person is very much terrorized, then psychological support is needed. So basic needs we have to see in form of clothing, fooding, shelter, these things. Then we have to look for person with serious distress. Sometimes 100 persons may be affected and few of them, 3 or 4 of them may be seriously distressed. They are very much anxious, showing all the behaviors of fearfulness, not able to sleep, constantly crying, shouting. So these persons are seriously distressed. I remember one person, I was posted to again 166 MH Jammu. In Rajouri there was a flood. In JNK there was a flood. 2000 I think 16 it happened. So entire bus carrying civil passengers swept away by flooding water, and the bus was crossing a overbridge. It was half, the bus tires were half submerged in water, and still the driver tried to cross the overbridge. He thinking overbridge over the river. He thought that he will be able to pass through, and that point of time suddenly entire bus was swept away. In that bus there was one JCO and who was on leave, and entire family. They were evacuating their house and going to safe shelter in a civil bus that point of time. Entire bus was swept. Nobody, not even a single family member that JCO could found. Their body was not recovered. And that point of time, that JCO was brought by civilians. After knowing that he is a soldier, he is from army, then he was brought by civilians to military hospital Jammu. That soldier was ready to jump inside the river at that point of time. So this is people with serious distress because he lost wife and 2 children, and I think 1 or 2 more family members also. That point of time he was very much disturbed, and he was about to jump inside the river. He was about to end his life. So we have to see always those persons who are in distress, and we have to give psychological first aid and priority. Then we have to listen. Listen for what? We have to listen the individual first. We have to ask them. We have to learn, listen to their suffering, listen to their need. Why listening is important? Because after listening only you will know what is the priority for them, and then only you can help them better. I was a part of Op Kosi Prahar. Op Kosi Prahar is a exercise when there was flood in North Bihar, because of floods from Nepal. The barrage was broken and sudden flood came to that region, and half of the North Bihar was submerged. And I was posted in Ranchi in a field hospital. I was sent for Op Kosi Prahar, 2000 I think 8 or something, 7 or 8. That point of time, what happened? Our team, we were having engineer boats. So that one engineer company was with us, and the boat was there. We were evacuating every possible person from the flood affected area in our area of responsibility. One time our boat went to the house. One lady was stranded there. The lady was evacuated. She was saying something and crying. The soldiers were from the south. They could not understand the local language. They pulled the lady, made her sit in the boat, evacuated the lady. After reaching our camp where the lady was there, I was there and she was constantly crying. Then I could understand that she was telling that my only son is there in that house, and I was telling these soldiers that he should be evacuated first, but he was not evacuated, and I was forced to board on the raft. So this happened and we lost that child. This is because we did not listen to the lady. We did not listen to the individual. That is why it is very much important. We have to listen. What is their need? One person refused to board to boat. He said that no, take our Gram Pradhan first. Mukhya ji pehle jayenge. Then only I will board. This is their custom. We have to listen. Sometimes we have to respect their customs. We have to respect their cultural needs also. We have to, certainly that listening helps. So I was saying these examples which are real, because you may always relate that these real examples make us more wise rather than this theoretical saying or teaching. Then link. After listening, after knowing the event and all the resources, after listening to the individual need, link these things, link their requirement with the services available. Suppose they need basic need, tell them where they can have water, where they can have food, where they can have shelter, where they can have clothing. You can say, na, look, this is the line of clothing. You can get the clothing here, go into that line, stand there. Or you can say that there is open langar there, anybody can have food. So these things we have to link. Sometimes we have to link to the service which is not here. We have to tell them. We have to take the help of authorities that call in this number, ambulance will come. Call at this number, somebody will come to your house for help. Somebody will come for building your house. Somebody will come to connect to your near and dear ones. If you have lost somebody, contact this agency. They will find your child. They will find your husband. So like this, we have to link the person with the resources available. Linking to the service is very much important, because alone you are nobody, nothing. You can do anything. Lot of services are needed, and you are there to link. So you have to link there. Then we have to help people cope with the problem. That means suppose a person is there and he is suffering from anxiety because he lost his whole house, he is sad, grief, he is grieving. Then how can you help him coping with the problem? You have to be very empathic. You have to tell certain things, and then you have to make him comfortable. What is the meaning of empathy? You have to tell that I know what is going on in your mind after witnessing so devastating event. Even if I would have been the same feeling if I would have been at your place, I can understand. This is a kind of showing, we can say, acknowledging his feelings or her feelings. And then we have to say that if possible, can you tell me what help can I provide to you? What all help can I give to you to recover from this event? The person may say, I have lost everything, I have not the facilities of that and that, so and so, I have lost my family members. You have to listen to them, and then you have to give information and further social support, like you have to tell them that this NGO is going to take care of you further on, or this organization will going to give you further help. So we have to give different kind of social links or social supports groups. We have to introduce them to social support groups. Sometimes what happens now, many support groups comes. In the COVID situation, many support groups, they came forward. They were providing food, shelter, safe water, medicines to all the persons who were walking for many kilometers. Many few persons, they have traveled on foot for more than 100 kilometers, 200 kilometers to reach to their destination during COVID lockdown. So that point of time, many local groups, local supporters, they were there. So that point of time, we have to link the suffering person to the local support groups or local support system there also. So there is something you can say doctrine. Don't pressure somebody to tell their story. Suppose they are not comfortable. Suppose they are not in a position to tell you everything. Give them little time. Let them recover little bit. Let them cry. Let them console, and afterwards they will tell. If they are telling, don't interrupt and don't rush them. जल्दी बताओ क्या हुआ और क्या हुआ. Don't rush. Give them time. Don't give their opinion. ओहो तुमने तो उसको बचा लिया होता अगर हाथ दे दिया होता. तुमने बचाया क्यों नहीं? ऐसा नहीं बोलना. No, don't give your opinion. Don't judge their condition. Just listen. Don't touch a person if it is considered inappropriate. In many situations, Arab countries, you can't touch a lady. They will cut your hand if you touch the lady. In Africa, it is not considered good. In India also, we tried not to touch, so it happens. Sometimes it happens. We have to respect. So don't touch a person if you are not sure if it is appropriate. Maintain a comfortable and I can say distance so that the person is comfortable, and talk to the person. Then don't judge, I already told. Don't make up things you don't know. That means suppose some information is not known to you, tell them. अभी मुझे पता नहीं है, I will tell you later on. Don't use technical terms. Lot of things. Tectonic plate is causing this problem. So the earthquake happens because of continuous shifting of these two continents and trying to meet each other. So don't tell these things. What is the meaning of tectonic plate explanation at that point of time? So don't use technical terms. Don't tell them someone else's story. I am telling my story, but don't tell them someone else's story. Look, this happens with that person also. Oh, you lost your father. That person has also lost mother. That person also. No, don't tell. Don't tell this. They are not there to listen to other stories. They are suffering. They are telling their own problem. You don't have to bother them with others' problem also. Don't talk about their own problem. Oh, you have lost father. I have also lost my father 3 days back. When before TD, he suffered massive heart attack. No, don't tell. Don't tell your own problem. You are having lot of problem. You think I am not in problem. A medical officer is telling to the person who is there to get PFA, that medical officer is telling that I am also having lot of problem. What do you think? I am here only to help your things. I am here to listen to your things. Who will help me? So you should not talk like this. Don't tell about your own problem that point of time. That point of time, the priority is that person. You have to set aside your personal problems. You have to set aside others' problems, and you have to listen to that person, because that person is the most important person in front of you at that point of time. Don't give false promise. I will certainly find your family members. I will make them alive. Don't give false promise. I will make your house. No, don't give. Don't give false reassurance. Tell them the fact and try to give them assurance which is possible. Don't feel that you have to solve all the problems. It is not possible to solve all the problems. You have your own limitation. You have been given only few days, maybe 3 days, 2 days time, and you have to tackle other persons also. So in that point of time, don't try to solve all the problems for them. Whatever possible, you will provide, and don't take away person's strength and sense of being able to take care of themselves. I will tell this in form of an example. A lady coming to you saying that I have lost my house, everything, and then you are offering that, oh, no problem. There is a hotel nearby. We have arranged some accommodation in hotel. Come to that place. That lady said, I have lost my house and will I be able to enjoy the facilities of hotel? No, I will be there with my uncle and aunt there, and they will take care of me. So, such kind of things, when the person is able to manage themselves, respect it. Sometimes they don't want to leave their position, they don't want to leave the location, respect them. Sometimes there will be a time, then after some time, when you have to depart, you have to end the help, you have to end the assistance, and that point of time you have to end it in a better manner, so that the person is now linked to local services. You have to say that, look, till the time I have taken care of you, now from this point onwards you have to contact this person, this agency, this number, and they will further help you. I was here for this period only, and this is my limitation. I have to go for another duty. Soldiers are for duty of fighting for the nation, and disaster relief is only emergency duty for some time. After some time, we have to hand over our role to civil authority. So we have to end the PFA, and that point of time we have to connect the person to the next authority, next NGO, next person available for help there. You have to leave them in a better way. There may not be always possible to exchange the numbers. There may not be always possible to take some. There should not be taking of gift or some kind of you can say some kind of favor from them. It should not be there. Then what is at last? This is the last slide. What is the role? The role of medical officer is to identify your own psychological stressor and de-stress yourself. The second thing is that you have to promote mental health well-being in yourself as well as in your family and in your society. Your society includes your military society also. Then you have to provide psychological first aid if needed. Whatever I taught today, it is only psychological first aid, and it can be provided by anybody. Now you are equipped with the knowledge to provide the psychological first aid. Understood? And the same thing can be given by anybody. If you train anybody, any person of your unit, any person of your organization with this kind of knowledge, then they will be able to provide psychological first aid. Although there is a designated course, there is a designated, you can say, structured course facility available. You can always take the course from Johns Hopkins University. That is also possible. But whatever I told you in this limited time, I think with this you may be able to perform the duties of a medical officer and in a combat situation, and always you will be able to provide psychological first aid. So you have to provide PFA if needed. Then you have to spread awareness about mental health, and you have to reduce the stigma in the community. Look, till the time I am facing stigma, about 2010 I got into my residency PG. The day when I got my PGs announced that I have chosen this thing, my entire family was in shock. Both sided, my in-laws side and my own family side. What subject you have chosen? पागलों का डॉक्टर. So this was their reaction. एक दिन में खाना ही नहीं बना एक दिन तक, बिल्कुल. So this happened. Gradually they realized now nothing can be changed. He has chosen something. And there is an important learning for me also. Actually, that point of time I was very, you can say, I was thinking that my life should be cool in army. I should choose a small subject. So I choose psychiatry. But later on, after going to residency, I realized that psychiatry has a lot of reading. So entire 3 years books, they were weighing more than my weight. So, and the best thing is that there was no little exposure to psychiatry in undergraduation. Very little. Only 12 pages of Davidson we used to read, and just for passing, just for doing few of the objective questions, just to pass the university exams. Nothing else. Even during rotation, many interns they plan leave during the psychiatry rotation. Especially, I know them, and they have currently also one of the intern planned for psychiatry rotation. After 3 days, she announced that I have to go on leave, sir. Like, okay, fine. This is the norm. They think that psychiatry is less needed, but you will realize psychiatry is needed everywhere. It is needed for you. It is needed for your own family. It is needed for your society. Later on, you will realize. So you have to spread awareness, and you have to reduce the stigma about psychological status, psychological sufferings, and psychiatric illnesses also. You have to listen with empathy, but at the same time, don't get overwhelmed. A person is crying, telling his story, and Dr. Saab is also crying with the person. Does it look nice? Then that person will stop and he will start consoling you. And he will tell Dr. Saab, please chup ho jaiye. So this should not happen. You have to listen very calmly, and you have to maintain your own emotional health. No? That point of time you have to be very stable. And you have to refer the person to mental health professional if needed. If you are not referring a person to mental health professional, you are actually not doing justice with your profession. Sometimes medical officer thinks इसको भेज देंगे तो एक कैटेगरी हो जाएगा, and then person I am trying to help, he thinks that I am trying to help him by not sending him for alcohol dependence syndrome, because he will be given category, he will be under observation for some time, he will be losing promotion, something, he may think that person dies in a state of delirium tremens after a few months. That person dies because of acute pancreatitis. That person becomes a case of head and neck carcinoma after few years. That person dies because of coronary artery disease. That person dies because of cirrhosis of liver. And that person becomes permanently ill because of substance-induced psychotic disorders for whole life. That may happen. So you are not actually helping the individual by not referring him to psychiatry evaluation or psychiatric help. Rather, you are doing something harm to him. So just think about. Then maintain the confidentiality. Avoid loose talk among yourself. Don't talk about the patient. Especially don't talk about the psychiatric patient. Look, क्या हुआ पता है? वो जो बंदा है ना, उसको तो ये बीमारी है. Now you are telling everybody about that person. You know something because of your position, because you are a medical officer. He has confidentiality into you. He has confided something to you, thinking that you will not divulge the secret, and now you are telling everybody. This is against medical ethics. So because psychological stresses or psychiatric illnesses, it requires telling lot of things. Person may tell to you about their childhood experiences, traumatic childhood experiences, their abuses. Person may have to tell about their own shortcomings, their own misdeeds in past. That point of time, you have to listen to them, and at the same time, you have to maintain the confidentiality. You do not have to divulge the identity of the person at any point of time. Otherwise, you will be sued in a court of law, and entire salary, entire saving will be taken away from you. Don't discriminate a patient of schizophrenia, and that can also, the person of schizophrenia may have appendicitis. What happened? One person was there with us, suffering from some of the illness, some psychiatric illness. Suddenly he had a chest pain. And my nursing assistant, my staff, they were well trained. They understood there is something wrong, and our MOIC, she was also very, you can say, alert. She said, immediately rush to my room, and that point of time, that person could be saved because he was having a massive heart attack, MI. That person was saved. So even a psychiatric person can have MI. If we say that no, इसको तो एंजाइटी होगी, इसको तो ऐसे ही नाटक कर रहा है, and we do not listen to the person. Even you should know that psychiatric patients are more vulnerable to physical illness because they don't take care of themselves. They are unable to take care of themselves because of some, you can say, psychological illnesses, some of the limitations of mind, and that point of time they need more care. And I need you to promise that you will get yourself further trained in mental health whenever there is possibility, by any means, because it is need of the hour. Psychiatrists are less in our country, and our role is being performed by quacks, sometimes babas, and it is very unfortunate. So doctors have to take the role of psychiatrist wherever psychiatric facilities are not available. I am very much thankful to our colleagues who are doing neurology, neuropsychiatry, physicians. They are taking a lot of loads. Many persons are going to neurologists, neurosurgeons, physicians, and they are getting treated from them. Although they are not formally and structurally trained to diagnose and treat mental illness, but at least they are getting some help. If they come to psychiatrists, certainly it will be great help for them. But till the time they are not even getting any services, they should get all the services whatever available there. I was speaking to many of the patients. They are not having facilities at their entire district. They said that वहाँ कोई है नहीं. So it happens. So get yourself trained in mental health whenever possible. So with this I end my today's topic, both the topics. I am ready to answer any questions. You can ask your queries. Anybody? No. All persons are having mobile phone? No. Whenever you get mobile phone, go to YouTube, search Mansik Sahayata. I have established YouTube channel for education. Okay? It is for educating the troops, family members also, may be possible. Certainly it will help your client. There are two things there. There are psychological relaxation, guided relaxation there. So you can always go and see. I'll just show that.